Good afternoon. Good afternoon, everyone. My paper is on decrypting the mystery of bilateral unreactive pupils. There is no financial interest in this case study. AD's pupil is an efferent pupillary defect in which there is parasympathetic denervation of the afflicted pupil. It is usually an unilateral condition common in young female with underlying local and systemic factors. The occurrence of isolated bilateral simultaneous AD stonic pupil in a 14-year-old male need a detailed workup. This is a case report of 14-year-old male came to OPD with complaints of difficulty in seeing bright light for past 1 year. History of difficulty in reading was present. No history of redness or watering of eyes, headache, fever, no history of drug usage, no history of any systemic illness or autoimmune disorders, no history of ocular trauma or surgery. On ophthalmic examination, his vision was improving to 6.6 in both eyes, but near vision, he had near vision defect, which was corrected with plus 0.5 D sphere. Other anterior segment examinations were normal, but pupil was 5 mm. Both eye pupil was not reacting to light, both direct and indirect, in bright and dim light, and accommodation reflex was absent. His near point of accommodation was 14 centimeter, and near point of convergence was 9 centimeter. Fundus, color vision, contrast sensitivity, fields and extraocular movements were normal. On systemic examination, deep tendon reflexes were elicited and were normal, and systemic examination of CVS, RS, CNS, everything was normal, and blood pressure was 120/80 within normal limits. On digging into diagnosis, the denervation supersensitivity test was undertaken. The patient underwent dilute pilocarpine test of 0.125% in dim light room. Pupillary right reflex was recorded at baseline and at 30 minutes after instilling the drops. Here, this is a video of the non-reacting pupil. This is a video of non-reacting pupil, and after installation of pilocarpine in dim light, the pupil constricted and it reacted. This is the picture before pilocarpine test and after pilocarpine test, which the pupil constricted and reacted to light. Pre-drug and post-drug effect. Near vision was N8, pre-drug, and post-drug it was N6, and near point of accommodation reduced from 14 to 10, and near point of conversion from 9 to 7 centimeter. Light reflex, direct and indirect was absent, and near reflex was also absent, and 0.1% pilocarpine test was positive. This made a diagnostic dilemma, and it's a diagnosis of exclusion. It came up to AD stonic pupil, ruling out Ergel-Robertson pupil as accommodation reflex is absent. Pharmacological mydriasis as iris is normal. There is no history of use of any mydriatics, and pilocarpine test was positive. And traumatic mydriasis, since the iris was normal and anterior segment structures were normal. Third, cranial nerve palsy was ruled out since ocular movements were full, and congenital mydriasis was ruled out since pilocarpine test was positive. On treatment and follow-up, the patient has been advised to do a detailed neurological examination and serological workup to rule out any associated diseases. MRI brain showed no significant abnormality. Neurology and cardiology examination was found to be normal. Serological examination does not show any abnormality. Best glasses for the near vision has been prescribed. On discussion, mydriasis is often an worrying sign. Neurological causes to be ruled out by neuroimaging. Ocular and systemic abnormalities also have to be investigated and evaluated. Here we present a rare case of isolated simultaneous bilateral ADs pupil in a young male. Our patient did not have any associated ocular or systemic pathology. However, intracranial cause was ruled out using neuroimaging, emphasizing its importance. AD-stonic people is a disorder of unknown etiology in which there is an injury to postganglionic parasympathetic nerves resulting in poor light. This is a flow chart of how we did the diluted pilocarpine test, for which large pupil constricted and suggested supersensitivity in AD-stonic people. Thank you.
Thank you.
Did you check for any reflexes?
Ma'am?
Did you check for any reflexes? Did she have any neurological workup?
Yeah, he did he's a male patient, he did every neurological workup, it turned to be negative, everything was normal. Sir, for bilateral ADS people, since the pupil is not reacting, we suspected some neurological pathologies like dorsal brainstem disorders, like that we suspected and advised for MRI. And dorsal midbrain symptoms. No, sir. People will not react to light.